First of all, I'd like to say thank you for all coming. I'm sure you're all busy making snowmen, sledging, snowball fights just now. I wouldn't blame you, that's probably what I would be doing as well. I'm just going to talk briefly about what happened to me and touch on a few things that the doctor was just speaking about. Now, you've been listening for a long time, so I'm just going to break things up a little bit. If everyone could just look to the person on your left and look to the person on your right. Now, that's 3 people. Unfortunately, the statistic is 1 in those 3 is going to be affected by somebody in cancer. Now, we hear the statistics, we understand the statistic, but we don't actually give it as much respect as we should. So you've just done it there. Unfortunately, 1 of you 3 will probably in some way be affected by cancer. What happened to me was just after I graduated at the age of 22, I started getting sick, I started getting the symptoms. I started getting a lump in my neck, extremely bad night sweats, and a really horrible cough. But I suppose I done the natural thing, and that I chose to do nothing. Foolishness, being young, I chose to put other things ahead of my health. And because of that, I never went to the doctor until my fantastic mother gave me a slap at the back of the head and said, go see him. Finally, I went to the doctor, and the doctor said to me, this is something serious, you need to get it checked out. Still didn't decide to go take it any further, but then things started to get worse, and my health just deteriorated rapidly, and I had to take time off work. So we then started to go forward into the hospitals and go to get all the checkups and get all the diagnoses. And after about 2 months worth of testing, I finally got the diagnosis, which nobody wants to hear, but everyone does have a slight suspicion of. Unfortunately, it was cancer, and it was devastating. Suddenly, everything was just a case of what's going to happen now. For me, my friends, my family, it was a very difficult time. But the NHS has things there to support you, and this is why it is so important for things like today, MacMillan, Teenage Cancer Trust, the doctors' resources, they're all there to help you. You just have to empower yourself to actually go and find out. Once we had found out what it was, we then started the chemotherapy. And it wasn't, I'm not going to be honest, it wasn't fun, but we managed to get through it. Then wait for a secondary scan, and it turned out that I hadn't cleared up as much as possible. And I was put on a stronger regime. This involved actually having to spend time in the hospital. And some people do think that spending time in the hospital is fun because you get to lie in bed and eat food all day, but hospital food's not that great, despite appearances. It's not tasty. So unfortunately it was a very difficult time. So at the start of the year I went through my stem cell transplant, and thankfully I'm in remission now and things are looking much better. I was foolish. I chose not to get it checked out at the early stages. Please don't make the same mistake as me, because if you can get it checked at the start, it saves you a lot of hassle and it saves you a lot of hardship. Don't be like me and think it's something, I'll just leave it to the side. If you feel there's something wrong, get it checked out, get it looked at. And if you don't like what your doctor's saying, get it checked out by another person. You have the power, the resources there for you. So just to finish up, basically, the main things about cancer is it's increasingly affecting more of us, but early prevention is probably your biggest weapon against it. So I'd like to thank you all again for coming today, and thank you for listening to my presentation.